Did you know women are 50% more likely than men to receive an incorrect diagnosis after having a heart attack? And research has linked stages of menopause with increased risk for sleep disorders, depression, anxiety, and cardiovascular disease. Also, women have a much higher chance of developing osteoporosis and related fractures compared to men. And recent studies suggest that women may have different risk, prevalence, and severity of lung cancer. These aren't just statistics. They represent real patients we take care of every day. All areas of health, from disease risk factors to responses to treatments, are different between men and women. To provide truly personalized care, we must understand these differences. Join leading experts at the Medical Women's International Association to learn how to improve outcomes for your women patients. Because better understanding leads to better care.
Navigating pregnancy options counseling requires a delicate balance, providing complete information, maintaining neutrality, and offering support while also respecting autonomy. Your role is to meet them where they are, while ensuring they receive complete, medically accurate information about all their options. You'll learn practical strategies to implement these approaches in your daily practice. We'll focus on real-world scenarios that show how to maintain non-directive counseling while providing comprehensive care, moving beyond theory to address the situations you encounter every day. Remember, our role is to provide accurate, complete information while supporting each patient's right to make their own informed decisions.
Hello. Let's talk about something important. Emergency contraception, also known as EC. It's a safe way to prevent pregnancy after sex. Think of EC as a backup plan when you need birth control after sex instead of before. It's not the same as the abortion pill. EC does not interrupt an existing pregnancy. Instead, it helps prevent a pregnancy from happening after sex, especially if you didn't use birth control, it didn't work right, or you didn't consent to sex. So when might you need EC? Maybe the condom broke or you forgot your regular birth control. The key is to act fast. EC is most effective when taken within 72 hours after sex, but it can work up to 5 days later. There are two kinds of emergency contraception. First, there are EC pills, also known as morning after pills. EC pills are available over the counter and by prescription, depending on type. The second kind of EC are small devices called IUDs, which are placed inside the uterus. There are IUDs with hormones and without hormones. Both are really effective at preventing pregnancy after unprotected sex and can be used as long-term birth control methods. All these emergency contraception methods are designed to prevent pregnancy. They don't cause an abortion and won't work if someone is already pregnant. Getting EC is easier than you might think. Thanks to Missouri Family Health Council, you can get it for free. Missouri Family Health Council has joined with health centers and other community partners to distribute free EC kits throughout Missouri. Visit mfhc.org to find out where you can pick it up or order a kit right to your doorstep. It's confidential and quick. EC is also available through retail pharmacies over the counter without a prescription. A couple of things to remember. Over-the-counter emergency contraceptive pills may be less effective for people who weigh over 165 pounds. A prescription EC pill or IUD may work better. If you weigh more than 165 pounds, talk to your healthcare provider or visit mfhc.org to find a healthcare provider near you. Remember, emergency contraception is here for you when you need that extra peace of mind. It's all about making informed choices for your health and future. You can access emergency contraception for use immediately or to have it just in case you need it. Just be sure to store the pills at room temperature and use before the expiration date on the package. For more information, visit mfhc.org.
Let's walk through a case. A 22-year-old woman visits your clinic to discuss contraception. During the conversation, she shares that she's had multiple partners recently, sometimes without condoms, and was treated for chlamydia 2 months ago. You recognize this as an opportunity to assess her HIV risk using the 6 Ps: partners, practices, protection from STIs, past history of STIs, pregnancy intention, and pleasure. Based on what she shares, she meets multiple criteria for PrEP candidacy. She also asks whether PrEP is safe to use if she becomes pregnant or while breastfeeding, and you reassure her that it is. You counsel her on what PrEP is, how it works, and the available options, including daily oral medication and long-acting injectables. After discussing her lifestyle and preferences, you offer her the choice to start PrEP today or revisit the conversation in the future.
Navigating pregnancy options counseling requires a delicate balance, providing complete information, maintaining neutrality, and offering support while also respecting autonomy. Your role is to meet them where they are, while ensuring they receive complete, medically accurate information about all their options. You'll learn practical strategies to implement these approaches in your daily practice. We'll focus on real-world scenarios that show how to maintain non-directive counseling while providing comprehensive care, moving beyond theory to address the situations you encounter every day. Remember, our role is to provide accurate, complete information while supporting each patient's right to make their own informed decisions.
Our brains love grouping people, places, and things together. For example, try matching these drivers with their vehicle. Did you match the truck with the farmer, the minivan with the mom and children, and the convertible with the executive? We rely on snap judgments like this all the time to save our brain's energy, but making quick assumptions about other people is also a shortcut to misunderstanding them. It's worth slowing down to remember that when we make snap judgments about people, whether it's what type of car they drive, what kind of neighborhood they live in, or what country they're from, these assumptions fall back on implicit biases. Implicit biases can impact the treatment clients receive from sexual and reproductive health providers. For example, a client's perceived race, gender, or sexual orientation may negatively influence which contraceptive methods are recommended to them. To understand how this happens, it helps to know how implicit bias works. Implicit bias refers to subconscious attitudes, beliefs, and stereotypes that affect our behaviors towards individuals or groups. Implicit biases operate on an automatic level in our brains. They can be formed based on societal norms, media representations, personal experiences, or cultural conditioning. If left unaddressed, implicit biases can perpetuate social inequities. For example, clients with low incomes and Black and Latina clients are more likely to report discriminatory practices in contraception counseling, including pressure to use long-acting types of contraception. A study from the American Journal of Obstetrics and Gynecology found that intrauterine contraception recommendations by healthcare providers vary depending on the client's perceived race and their socioeconomic status, as shown in this chart. Black and Latina clients are more likely to have a cesarean delivery than white women, increasing the risk of pregnancy-related mortality. At their most extreme, implicit biases can have life or death consequences. The first step in safeguarding against implicit bias is to be curious about one's own biases. Having an implicit bias does not necessarily mean a person is intentionally discriminatory. Implicit biases are deeply ingrained habitual processes. They will not go away magically overnight, which is why it is necessary to practice self-awareness strategies. It is crucial to identify biased thought patterns before they become explicit, harmful behavior. A few strategies include: slow down client interactions. Resist the quick urge to interpret and diagnose without listening. Do not assume that your interpretation is always accurate. Embrace empathy. Consider how your actions or decisions may impact individuals from different backgrounds. Actively seek to understand their experiences, challenges, and perspectives. Build an anti-bias community. Seek opportunities to engage in discussions with peers, mentors, or other individuals with whom you feel safe discussing implicit biases and how to mitigate them in your work. Managing implicit bias is a journey, not a destination. It takes practice and continued commitment. Every day that we choose to challenge our biases, we work towards creating more equitable environments for all our clients seeking sexual and reproductive health services.